Hey guys, Toby Morrison here. Welcome to today's video on graded exercise therapy versus restorative exercise movement. Now, graded exercise therapy is a very interesting topic, and exercise in general is a very interesting topic. And if you actually look at my past YouTube video on exercise, you'll see that it's had, well over 10,000 or 20,000 views already. And I explained to you exactly why exercise is important, but how it should be done and when it shouldn't be done, because as we all know, there's times when we shouldn't do anything, and then there's times where we should do stuff to help us, to propel us, to move us forward in the direction of health, stamina and energy. So today's topic is specifically revolved around graded exercise therapy because there's a lot of talk out there that it's actually not good for you. And the problem is that graded exercise therapy isn't actually the problem. It's how graded exercise therapy is prescribed to people. And there's some great components of graded exercise therapy in the sense that, it's progressional. It's usually done in a safe, effective way. But the problem is that it's not prescribed properly. And that's why that in our clinic and in our practice, in our online program, we don't actually teach graded exercise therapy. Because the problem with graded exercise therapy is that it's very linear in the sense that it goes like this, and there's no real room or flexibility to change that. And that's the problem right there, because as we know, with recovery, it's not always linear, it's not always straightforward. It's usually a bit like this. It's usually you start here, you improve, then you go down, then you improve, then you go down, then you improve, then you go down. And so, as you can see, it's a little bit hard to be consistent all the time, all right? Now, another problem with graded exercise therapy is that it's not that specific in the sense that it's not specific to the individual sometimes, and this is where the problem goes, and this is why people have bad experiences, is purely because it's not prescribed properly. So, we have to factor in a lot of things. We have to factor in emotion, we have to factor in stress levels, we have to factor in daily activities, we have to factor in nutrition, we have to factor in quality of sleep. So let's just say if someone hasn't slept well and then they go and do their graded exercise therapy session or exercise routine, but it's too much for them because they haven't slept well, they're underslept, they're already tired and fatigued, they don't have many credits in the bank, and then they're expending more energy than they're actually getting. And so then they're in a deficit, right? And the deficit isn't the problem, it's only whether the person has enough restorative energy to counteract that deficit and bring them back into balance. And as a healthy person, that's actually good. It's normal to have a little bit of a energy deficit after you move or exercise. But the problem with graded exercise therapy, as I said before, it's not always like this, right? And this is why in our programs and even when I coach people, it's very much a specific program. And I usually give two programs anyway, and we'll go into this in a second about restorative exercise movement. Because sometimes we need to progress forwards, but sometimes we need to calm our nervous system down, calm our body down, and actually get into recovery mode in the sense that our bodies actually grow and get stronger when we're resting. Now, if we're not resting that much, and if we're not doing the right recovery things like sleep, nutrition, restorative movement on top of your progressive exercise, then it's very hard to make steady ground, consistent change over a period of time, okay? Now we have to factor in, like I said before, other elements to this, and I'll write these here. So, one thing for sure, is sleep is important. Now, again, your sleep might not be perfect all the time, okay? If sleep is a problem, that's something that we could work on for sure. The other thing is nutrition. You're only as good as your last recovery, as they say, in terms of recovery session. So, in terms of physiologically, you're only as good as your last recovery session, in the sense that if you can wake up feeling well enough to do it again, then that's a good thing. But if you're constantly draining your body of energy, and physically doing way more than your body's capable of adapting to, then it's going to be a bit of a tug of war. And that's why graded exercise therapy has got such a bad name about it. Is not because it's a bad thing, it's just that it's prescribed wrongly for the wrong individual. Now, if someone's got a virus or an infection and they're trying to do a graded exercise therapy program, it's probably not the smartest thing to do, because they actually need more rest and relaxation in that period of time. Now, when their health is maintained and balanced, then they can start to move forward with appropriate movement plan to recondition their body, re-strengthen their immune system, and get them going in the right direction. And like I said, it's all about appropriateness, okay? Now, another thing here that you need to factor in is stress. And a lot of people, they'll have an exercise plan and then they'll have a setback and they'll blame it on the exercise plan. But a lot of the time, it could be to do with emotional and physical stress. Now, physical stress means poor nutrition, poor sleep. Emotional stress is mental stress. The thing is, we were designed to actually have a stress response for survival mode. The problem is when we're in a state of chronic fatigue syndrome or fibromyalgia or chronic illness, the issue is that the stress response is so high, there's like hypersensitivity, okay? And this is why it's important to start on a really low, graded approach. So it's not so specific in the sense that it has to be done in this way all the time, okay? That's the issue. So these are the three things you need to focus on if you're having issues with getting started or moving forwards: quality sleep, quality nutrition, and making sure and managing your stress, that you're calming your nervous system down and moving forwards in the right direction. So we're getting onto the good topic now, which is what you can do about it. Now, like I said before, if you watch my last YouTube video on exercise, chronic fatigue syndrome and exercise, you'll see that it's important to know when to go and when to slow. Restorative exercise movement is about getting energy in. Things that calm you down. Things that give you a little bit of energy, give you credit. So things like breathing exercises, stretching, meditation, restorative yoga, things that calm your system down, okay? Give you energy, restore energy. Again, there's nothing wrong with exerting energy, but we want to do it in the appropriate manner and at the appropriate time. If you're completely burnt out and you're always exhausted, then adding more exhaustion and burning yourself is not the way to go about it. In fact, you want to do the reverse, which is why we're quite big on restorative exercise movement, okay? Because it's flexible. And one day you might do 5 minutes, another day you might do 1 minute, another day you might do 30 minutes because it feels good for you and it's appropriate for you. Again, it always comes back down to appropriateness. But with restorative exercise movement, it will look something like this. You might do a little bit, you might maintain. You might do a little bit, you might maintain. You might do a little bit, you might maintain. And obviously, it's not going to be exactly linear like that, but you can see they're stepping stones. They're stepping stones to get to the next level of stamina, energy, and relaxation, okay? Rather than having these big dips like that, we can kind of say it's like a stairway to heaven, okay? I think in my last video, what I talked about is when you're overdoing it with anything really, and you crash into the valley of death. It's like a big pit where you all your symptoms flare up and you don't feel so crash hot. Now, that's the valley of death down here, but what we do is, if we call it the stairway to heaven, it's just slowly stepping towards, where you want to go in a nice, calm, mannered way, in a non-aroused state, really. That's what it's about. So, the most important thing to do is to make sure it's specific to you, okay? And also have a balance of both. Like I said before, it's all about appropriateness. So if you think it's okay for you to do a minute or two of walking or half an hour of walking and it feels okay and you feel okay after it and you're not completely drained of energy and you can wake up the next day and be okay, then that would be an appropriate amount for you. But if you're waking up with your symptoms completely switched on, overly aroused, overly irritable, muscle aches and pains all over, then it might be just a little bit inappropriate for you right now, which means you can just cut it back a little bit, okay? We usually say, to start with, do 50% of less than what you think you can do or should do. And that's a good starting gauge, because then you can walk into it very safe and calm and relaxed. But if you constantly feel like you're on edge about, is it too much, is it not too much, then the stress of that is actually the problem. It's not so much the exercise routine or the movement routine. The stress of the exercise routine or movement plan can be the actual problem, if that makes sense, because if you switch on your stress response too much, it's exhausting in itself. It's like running a marathon without taking a step, as you know. I'm sure a lot of you have experienced that before. So the most important thing to remember when you're doing stuff like this is appropriateness, and also balanced. Okay? And I'll talk about that to finish off with, in the sense that appropriateness means that it's appropriate and specific for you, and it's flexible. And this is where it comes into balance. Make sure that you have a flexible routine and structure and plan to do even on the not so good days. What can you do to help yourself? Rather than try and push through to a written plan or a fixed mindset on what you wish to do mentally, you need to do what your body is telling you to. You need to listen to that, and of course there's a time and place for everything. And sometimes if you're feeling really flat and you haven't done too much, sometimes the best thing to do is actually get up and do something, right? The more you rest, sometimes the more you decondition, the more you feel less energetic, the less blood flow that's getting circulated and things like that, okay? But you'll find that if you get up and do even just a tiny little bit, it'll improve your appetite, it'll improve your strength throughout your whole entire body, and also can help with reconditioning, which is really important for prevention of injury and structural problems like your lower back or your upper back can get into all sorts of pain and disjointed ways because it hasn't been moving functionally. Okay, so it's about functionality, it's about appropriateness, it's about balance, it's about flexibility. Okay, and I just want to really make sure that I get this point across, is that there is no right way. Okay, there is no right program. So the most important thing I can say to you, without even being your coach, because I don't know where you're at exactly, but it's about figuring out where you are at personally and going, okay, what's appropriate for me? What can I do? What do I need? Those three questions are great. Write them down. What's appropriate for me? What can I do? And what do I need? They're three questions that will really help you set up your week, set up your day, and listen to your body, but also listen carefully to the direction that you want to go, because you obviously want to improve and help yourself, but it's about doing it in an appropriate manner so you can avoid this whole boom and bust cycle which we spoke about before, and also bring energy in. Okay, you'll see a lot of ancient philosophers talk about yin and yang, and bringing energy in, giving yourself some time to truly rest and relax and rest and digest. And then the opposite of that is go and stress. Okay, and like I said before, there's nothing wrong with stress. Stress is actually a good thing. A stress response is usually any kind of change or adaptability in the body, right, physically or emotionally. It's just how well can our bodies do that, and it's about listening to that, engaging that, and then slowly stepping forwards. Like I said, the stairway to heaven versus the valley of death. Okay, slowly step towards your dreams and ambitions in a way that's appropriate for you, in a way that's right for you, and also allowing yourself that flexibility to say, you know what, some days I need a day off just to calm myself down. Some days I just need to do my breathing exercises. Some days I just need to do my stretching or restorative yoga or yin yoga. Okay, it's really important to make sure it's specific, appropriate, and flexible for you. And just know that just on the graded exercise therapy topic, it's a very subjectable way to measure somebody's progress. It's a very subjectable way to do a research paper on it, because there are so many determining factors and not included in those research papers, things like I said before, quality sleep, quality nutrition, and also stress levels, which can take a huge toll on the body, as we know, physically, just from mental stress. So it's important that is factored in and looked at within your plan of improving your life. There's no point adding more stress onto an already stressed body. And this is why graded exercise therapy is such a kind of a hard thing to look at and understand and go, well, is it good for me or is it bad for me? So I hope this video clears a few things up. Like I said before, there's no wrong or right, but it's about doing what works for you. What we're seeing with restorative exercise movement is seeing our clients recover and restore energy, but also help them move forwards in a really stable, consistent way to get back to healthy functioning living, which is what it's all about. Make sure you subscribe to this channel. Make sure you drop a comment below. Let me know if this helped you. And if you have any questions, I will try to answer you. All the best for now, and I'll see you soon. Take care.